I'm Miss Gray. I teach pre-nursing here at Buchtel High School in Akron Public Schools. Kids experience some of the skills and the knowledge base that they need to go on to nursing. It helps them decide whether they like nursing or not. It helps them kind of decide with some experience and exposure to nursing and skills. In their junior year, I'm working on a home health aide certificate for them, and then as a senior, they can get their STNA, or State Tested Nursing Assistant certificate. I take my seniors out into nursing homes and we work on senior citizens in long-term care facilities. They'll be ready to start the workforce in November of their senior year.
My name's Keziah Hilbrand. I go to Garfield. I'm in 11th grade.
My name's Elizabeth Watson. I go to Ellett and I'm in 11th grade.
After the summer in the first year, Miss Gray said we can go work in assisted living because we have a year of training. And then after this, we can go to medical school or we can be working at a nursing home or hospitals.
Just assisting nurses with like making beds and bringing patients water and food. Things like that.
They can have 3 medical terminology college credits, but they have to attain a B or an 80% to get those credits.
And if we go to college, we already know most of the stuff that we should know if we were to take it in a college class.
Going into colleges, you already have a foot in the door. You get college credits if you do well enough. It's a really good opportunity.
I do an interview with each student. We ask the students to fill out an application. I look for their writing abilities when they write the paragraph. I look at their attendance and citizenship, their grades, their teacher references, what their teachers say about them. And then I take the top 20 from the interviews. I try to make it as much as applying for a job as I can, because that's an experience they're going to need. So even if they don't make it in my program, they've had the experience of going through an interview. We move through fractions and percentages and proportions to get into dosages and administrations where they learn how to give injections and how to give a medication.
It's math that you don't normally use every day. Doses for medicine, it's like adding and subtracting fractions, multiplying decimals.
I tell my students if you get an 80% on a test, that's really good. But if you're out giving medication and you only get 80% correct, you've harmed 20% of your patients. You cannot make mistakes. A lot of my students come back and talk to me after they've graduated. And one of the things they always say is how much this program has helped them in college and with their college classes.
It's a fun program, but it's really hard. You have to be dedicated to do it, but it's really rewarding in the end.